tax credits available to many small businesses. If you don't have health insurance now and your income is $43,000 for an individual or less, or $88,000 or less for a family of 4, you will be entitled to go under this program and get full coverage up to 133% of the federal poverty level. Then if you are on a sliding scale up to between 133 and 400, you can get something called affordability credits to help you purchase your own health insurance through the exchange. One of the things that's in the House bill, and this is not in the Senate bill, but it's in the House bill, one component of how to pay for this bill is a new surcharge tax for individuals who make over $280,000 or married couples who make more than $350,000. In the 1st district that I represent, based upon current tax information, 99.33% of the people I represent will see no tax increase under the surcharge. Number 4, how are we paying for this? This bill, according to the latest CBO estimate, after the bill was introduced and amended, is that it would be fully paid for over 10 years and actually produce a $6 billion surplus. Where does that money come from? The surplus, the money.
Ladies and gentlemen, really, please, this is about your neighbors and being respectful of people with differing opinions here. So let's let them go ahead and finish, and then we'll get to this question too.
Yes, it does go both ways. Absolutely. The surcharge tax is what I already talked about, would be one component of how we pay for it. Another very important component is cost savings from big drug companies and big insurance companies who have earned billions of dollars in profits as healthcare costs have soared. Then also long-term savings from the prevention, wellness, and changing how we pay for Medicare. What will happen to Medicare? There's been people that are saying that this is going to keep people from getting the Medicare treatment that they are entitled to. This goes back to what I was talking about earlier, and that's the enormous inefficiencies that already exist in our current healthcare delivery system. This bill is not about keeping seniors from getting health care. It's about making places like Miami and McAllen, Texas, more efficient in how they deliver health care. So the savings we're talking about are a permanent fix to how we pay Medicare payments to doctors, eliminating co-pays and deductibles in the preventive service portion of Medicare, and extending the solvency of Medicare by 5 years with this plan. Now, what I was working on, I mentioned earlier, is this Braley kind of Medicare Payment Improvement Act that moves from fee-for-services to a value index, and it's going to happen in 2 ways. First of all, the Institutes of Medicine are going to complete 2 studies. They've already done an enormous amount of work on this area. The first one is going to address this regional disparities problem, which has penalized doctors and hospitals in Iowa by paying them well below market rates for delivering consistently high care. And if they need to adjust the Medicare formula to address that, that will be resolved within 1 year. The second one is more detailed, and it will involve a 2-year study, but then they're going to come back with recommendations on how we change the reimbursement system to promote value, not volume, and base it on quality outcomes, not just the quantity of medical services. And this was an article that was in the Quad City Times about the work